Goeiedag, good day, fellow South Africans and citizens of the world. And last night we had a fantastic jamming session with 3 top musicians. Nearly went for 3 hours. It was fabulous. Now, let's get to the story. I've been saying for many weeks now, even before the lockdown started, that this lockdown can never work because of social distancing in townships and other places, and of course, the taxis. But they've done it anyway, and they've kept on with it. You've got to wonder what the actual motive for that is, especially concerning a video I just put up in the 2020 channel, which is unsubstantiated. Now, this is what a top government scientist advising the government has said. He says, the government's phased exit from the lockdown is nonsensical and unscientific, says one of the top scientists advising it. Dr. Glenda Gray, a member of the Ministerial Advisory Committee and chairperson of the South African Medical Research Council, or SAMRC, said the lockdown should be eradicated completely and that non-pharmaceutical interventions such as hand washing, wearing masks, social distancing, and prohibition on gatherings should be put in place. The month-to-month phasing out of the lockdown has no basis in science. Many lockdown regulations were seemingly thumbsucks. The government needs to reflect on its decision and admit it had made mistakes because the nature of the pandemic was always changing, she said. She said, you also have to be nimble enough. You have to either balance saving your face or saving your country. And which is more important? Well, this is the ANC, so we know the answer to that. Gray is a specialist paediatrician and HIV vaccine researcher. She received South Africa's highest honor, the Order of Mapungubwe, and was named one of Time magazine's 100 most influential people in 2017. She said, we are seeing children with malnutrition for the first time at Hani Baragwanath Academic Hospital. We have not seen malnutrition for decades, and so we are seeing it for the first time in the hospital. She was not speaking on behalf of the MAC. Apart from serving on the MAC, she is also campaigning for South Africa to be part of COVID-19 vaccine trials, which I certainly would not want anyone to be on. Gray said the evidence behind certain lockdown regulations was uncompelling. For example, open-toe shoes were not allowed to be bought or sold during the lockdown. She said, this strategy is not based in science and is completely unmeasured. It's almost as if someone is sucking regulations out of their thumb and implementing rubbish, quite frankly. Well, that's happening because the ANC government are clueless. In the face of a young population, we refuse to let our people out. We make them exercise for 3 hours a day and then complain that there's been congestion in this time. We publish children and kick them out of school, and we deny them education. For what? Where is the scientific evidence for that? Initially, there was a good reason to implement the lockdown to slow down the spread of the virus and buy time to ready the health system. And this was largely achieved, Gray said. She said, one can argue whether the extension of the lockdown and these alert levels are justified, and I think we could argue that an additional 2 weeks in the lockdown may have supported the work that had been started and was critical. But the de-escalation month on month to various levels is nonsensical and unscientific. Questions have also been raised about whether the government is listening to the expert advice of the MAC's scientists. The MAC's overall chairperson, Professor Salim Abdul Karim, said it was not true that the government had ignored advice on the issue. Another member, associate professor at the Clinical HIV Research Unit at Wits University and CE of Right to Care, Dr. Ian Sand, said the committee was not asked whether the lockdown should be downgraded to level 3 or any broader questions related to the issue. The committee was asked to advise on a risk-adjusted approach to focus on hotspots, a screening and testing strategy, and in turn, lockdown. Sands said, "We were asked about the approach, not the trigger levels in relationship to economic activity. We were informed that this would in future be utilized to determine the lockdown and economic activity in areas where the risk of COVID-19 is less, and we agreed with," he added. Gray questioned why the government appeared to be proceeding without seeking proper advice, especially regarding regulations. He said, "We believe as scientists that we can give and are giving the government good advice, and why they decide not to take advice or engage readily with the scientists is unknown. Why have experts if you don't really care what they think? Non-pharmaceutical interventions should include targeted strategies to protect the vulnerable, while those who would not be affected by the virus should be allowed back into society," she said. Gray said, "With increased knowledge of the virus, we know that those most vulnerable are the elderly and those with comorbidities. However, people under 30 and school-going children are not. So you then have to deal with these people. You don't put the whole country into lockdown because you don't know how to deal with the elderly and the people who have vulnerabilities." South Africans bought in and everyone tightened their belts and took the lockdown with grace. During that period, we failed to deliver water, we failed to deliver food parcels, and we failed to make households on the brink of devastation safe. She said, "How can you continue to implement these restrictive levels when the data shows that the transmission of the virus will continue unless you implement non-pharmaceutical interventions to slow the transmission down or get a vaccine?" She concluded in saying, "We know what we have to do. We have to implement NPIs, which is non-pharmaceutical interventions. I think the government has failed to understand the psyche of its populace," she said. Sands said that the extended lockdown was having a negative impact on the healthcare system. He added that normal, non-COVID related diseases were not receiving attention. Sands told the paper that there had been an increase in missed appointments by HIV patients of between 40 to 60% since the lockdown, and a similar issue was expected for diabetes and other illnesses needing chronic medication. There had been a substantive decline in childhood vaccination programs, he said, which scientists believe would lead to a substantial outbreak of childhood diseases in the future. Another example was semi-urgent surgeries like spinal surgeries or early onset cancer treatments. Maternity screenings are also being affected, possibly leading to an increase in maternal and early childhood related illnesses. Hospital admissions have declined by 75% in the private sector, although the same data was not available for public sector hospitals. Sands said, "It may be because of the fear of COVID-19, we don't know, but elective procedures are not happening. While we don't have that many COVID-19 patients admitted, we should be using the opportunity to catch up on elective surgery." He added that many clinics were empty. Although people were allowed to go, there was a perception they could not do so and that it was not safe. MAC member Professor Mark Mendelsohn, who is the head of infectious diseases and HIV medicine at Groote Schuur Hospital, is also of the belief that the phasing out of the lockdown is not a scientific-led approach. He said it was based on the experience of other countries' attempts to flatten the curve, but the thinking still posed problems, adding the only countries which successfully flattened the curve through lockdown were those who were able to swiftly test, trace, and quarantine on a mass scale. And may I add, to actually enforce the social distancing. He said that has not been possible in South Africa, despite predictions up to 36,000 tests per day being done by the end of April. That has not been manifested. The only way to reduce the rate of infection is through interventions such as social distancing. There's the missing link, guys. Social distancing, hand washing, mask wearing, and cough etiquette. Mendelsohn said, Infections are inevitable. 60% or so of our country will become infected over the next 2 years, but limiting the rate of infections is not going to come through lockdown. While the central questions the government is asking are about balancing the impact of the lockdown with the rate of infections, Mendelsohn said he believed that the evidence they are basing their assumptions on is wrong. He said lockdown is in its current form doing more harm than good, and given the resource constraints of the country, we need to refocus the central tenet of prevention of the non-therapeutic interventions already described while opening up the economy quicker. The stance by Gray and other MAC members has led to questions about whether the MAC's advice is being heeded by the government. Department of Health spokesperson Popo Maja said the MAC had provided advice on the lockdown, that it had achieved its objective and a further extension of the lockdown beyond the 5 weeks was unlikely to produce any further reduction or spread of the infection. The argument that there is a very good evidence about the measures to be taken and we should simply follow such a path is simply inaccurate, Maja said, adding that the government takes the advice of the MAC seriously. Maja said the responsibility for implementation is government, not the MAC. Hence, we simply can't implement the advice of the MAC without interrogating the matter as government, since we are ultimately responsible and accountable. So in other words, they don't take any notice of this expert committee. Good, nice. Maja added that government around the globe were using epidemiological data to inform the decisions, including South Africa, which had been singled out by the World Health Organization for the measures taken to constrain the virus. Well, the World Health Organization, quite honestly, is a complete and utter joke. And that's self-evident. Maja said, none of the members of the MAC have raised with the Minister or the Director General that they are in disagreement with the path being taken by the government. So there you go. The chief research body or scientific body that's supposed to be advising the government is being ignored by the government during this lockdown and the process that it should be taken. That kind of spells up the ANC government, the gangster state and chaos. Absolutely clueless. Please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. Bye for now.